Welcome back, all of you. And it's my pleasure to welcome you to the plenary session on aligning actions across sectors to achieve healthy diets and nutrition goals. And this session will particularly talk about insights from Sri Lanka. To co-chair the session, I would like to invite Dr. Hirat Gunatilake, who obtained his PhD degree in resource economics from University of Hawaii and served as a professor and the head of Department of Agriculture Economics, University of Peradeniya, before joining the Asian Development Bank. He has widely published on various subjects on agriculture, natural resources, forestry, energy, environment, economics, and poverty. He is currently serving as the Executive Director of Center for Poverty Analysis, CEPA. Welcome, Dr. Hirat. Our second co-chair for this session is Professor Anand Chandrasekhara. He is the head of the Department of Applied Nutrition at Wayamba University of Sri Lanka and the current president of the Nutrition Society of Sri Lanka. As an academic and a researcher, his work focuses on insulin resistance, obesity, and diabetes. Professor Chandrasekhara holds a PhD in clinical nutrition from Sydney University and master's in teaching from Melbourne University. He has completed studies in medicine, agriculture, and food and nutrition at the University of Peradeniya. His contributions to the field of nutrition and health are widely recognized, both nationally and internationally. Can we have a round of applause for our chairs? Now I will hand it over to the chairs to take the session forward, and we'll request all the presenters to come one by one to make their presentation so we don't block the screen. And during the Q&A session, all of you can come up and sit so we can have the Q&A. So over to you, Dr. Gunatilake and Dr. Chandrasekhara.
Thank you, Isha, for your kind introduction. And actually, I am not a specialist on nutrition, so I'm here kind of representing some layman's view about nutrition. But to just set the scene for this very important session, I would like to remind you what has been happening in Sri Lanka during last 2-3 years. As you all are very well aware, Sri Lanka is still going through a severe economic crisis. After the COVID-19 pandemic, I think we had this economic crisis which had two major aspects. One, actually, we had foreign currency deficit that actually we were not able to repay our loans and so on. So the second part of this is actually the debt crisis, that we were in an unsustainable debt level, which eventually precipitated into severe economic and political crisis in the country. Now, Sri Lanka used to be a country that was praised all over the world for its great achievements in poverty reduction. Poverty levels, headcount ratio was down to 4% before the crisis. And now actually recent estimates show that it is like official statistics show about 30%. Some of our own studies show that poverty is still increasing. Perhaps poverty levels have gone up to 60%. This is a very alarming level of poverty, which has a very direct implication on nutrition status of the people in this country. Now, our own studies show that one of SEPA's Center for Poverty Analysis own studies show that about 20% of the households we interview say that they have shifted from 3 meals to 2 meals. And also there are very clear evidence that the quality of these meals also have deteriorated very badly. So that actually now when you are in economic crisis, there are multiple impacts. But of these impacts, some of the impacts like the income losses, job losses, asset losses, we can recover once the economy is back in the growing pace and so on. But the nutrition is very critical because the nutritional impact of this crisis on children can last for about 20-30 years. It can be for the next whole generation. In that context, I think this conference is very, very important. In this session, actually, we are talking about very very, very important. 3 topics are covered in this session. First presentation covers about the behavioral changes and whether these changes can be scaled up is the content of the first presentation. The second presentation talks about nutrition in adversity, how bad it is during the crisis to alert all of us and what we have done so far to solve this problem. And then third is basically looking at more improving the nutrition, focusing on fruits and vegetable consumption. So with that, I will hand over. I think these are the basic areas. I'll now hand over to Dr. Chandasiri for his part.
Okay, thank you, Dr. Gunathilaka. Actually, this session topic is very much related to the things that we are very interested about, especially as a nutrition society. We are working on these things very much. So the topic here is aligning actions across the sectors to achieve healthy diets and nutrition goals, insights from Sri Lanka. As Dr. Gunathilaka explained, that there are 3 presentations here. Dr. Supun Vijayasinghe, Gerald Rebello, and Quinn Marshall will be doing 3 presentations, and let me invite first Dr. Supun Vijayasinghe, who is consultant community physician at Sri Lanka Health Promotion Bureau, with expertise in public health, nutrition and infectious disease management and health information systems. Since 2019, he has led a national nutrition program, health promotion initiatives and community engagement projects, collaborating with UNICEF, WHO and other global organizations. His career spans roles at the Ministry of Health, Anti-Leprosy Campaign and Monash University. Dr. Vijayasinghe holds an MD and MSc in Community Medicine from the University of Colombo and MPH from EUCLID University and a Clinical Occupational Medicine certification from Monash University. Let's invite Dr. Vijayasinghe to make his presentation on the topic of can behavioral change interventions improve the nutrition at scale, challenges and opportunities in Sri Lanka. Before his presentation starts, let me explain very briefly about the ground rules. We will be given 10 minutes and we think after 5 minutes you will show a sign for the 5 minutes and then 2 minutes signal will be given. Thank you.
Thank you very much, co-chairs and ladies and gentlemen, distinguished guests. So thank you first of all for inviting me to deliver this presentation. So I'm going to talk something about behavior change, whether it can be used to improve nutrition and what are the challenges and opportunities in Sri Lanka. So basically, if you take Sri Lanka, I think most of you have, participated in the morning session. So most of you know, we face a triple burden of disease. Now, from one side, we have undernutrition, and from other side, we have overnutrition, and then we have micronutrient deficiencies. So these are the problems in Sri Lanka at a whole. So if you take the present situation, one of the co-chairs explained quite nicely. During the economic crisis, we had a huge problem, and pandemic also created and accelerated this whole situation. And nutrition-related challenges were so much during this time. And as most of you know, behavior change interventions are recognized as globally something effective that you can use to address nutritional challenges. Now, if you look at the current nutritional landscape in Sri Lanka, this is taken from 2024 data from the Family Health Bureau. So we have the latest data with that. So if you take stunting, it's about 10.5% in 2024, and it has increased to actually which was an increase from 10.3% in 2024. But wasting is a little bit less, but more or less same. It's about 9.3%, somewhere down from 10%, but that was stagnating over the years in that level. Now, if you take underweight, again, 17%, which is a big issue for us, and overweight obesity is one of the biggest issues that is up and coming in Sri Lanka, and it's becoming a huge problem, especially among school children. Now, if you take a look at the Sri Lankan present landscape, now the numbers are not just show the whole country situation. Now, I mean, if you look at it, it's widespread all over the country. Now, the numbers you can see in some areas, it's in dark red, so that it's highly affected. Now, the numbers are, not equally distributed. Now, the first one is for wasting, as you can see, from 23 to 24. This is just after the pandemic as well as the economic crisis era. So you can see, although there's improvement, but most of the areas you can see it's dark red, which is somewhere around 15 to about 15%. Now, the stunting is also quite similar. This is long-term nutritional issues. So this is among under 5. You can see the problem prevails. Now, if you look at role of behavior change interventions. Now, behavior change interventions are usually actions targeted at influence individuals as well as populations to improve health outcomes. Now, they mainly focus on something such as knowledge, attitude, beliefs, and widely environmental factors, which we call the determinants of nutrition. So it's evidence-based approach, and we have been practicing it for a long time at Health Promotion Bureau and most of the other, Family Health Bureau and other institutions as well. Now, if you look at the core components of behavior change, now you have education and awareness, and then you have technology integration. Now, if you take education and awareness, we are talking about mass media campaigns. We have done a lot of mass media campaigns, and then school-based campaigns are also there. Now, technology integration is one of the newest things that we have been practicing over the years. Now, if you look at mobile health apps, M-Health apps, which we are going to show in a while, you can see a lot of developments are there. And social media campaigns, of course, as the Health Promotion Bureau, we have reached about 600,000 users. So I think it's one of the biggest platforms, government platforms we are having at the moment. Now, the other biggest advantage is the community engagement component. So we have community level platforms called mother support groups. These are community health workers who are working with the health structures like the public health midwife and public health inspector. So they are trying to promote nutritional activities and trying to improve nutrition at grassroots level. And of course, policy and advocacy, such as national health policies, which have integrated behavior change into this. And then we have regulation of junk food and advertising targeting children. So we are somewhere there, but not up to the optimum. So if you take evidence from Sri Lanka, we have mobile-based interventions. This is one of the few studies we have done, actually, which we targeted in 5 districts. So we actually conducted this study in 5 districts in Sri Lanka, and it has shown it's really is promising. So this was 24 districts out of 24 districts. We have prioritized several districts here, and you can see the uptake was really good. Now, it shows a very good improvement in knowledge, attitude, and practices, especially related to under 5 children and breastfeeding practices as well. Now, this is another similar study we did in 2 districts. You can see we used the CGIAR score, Global Dietary Recommendation, and you can see it improved the minimum dietary diversity of women, as well as insecurity decreased, food insecurity decreased from 89% to something around 76%, which is statistically significant. Now, these are the other things we did, community engagement interventions, where we tested for social capital, where we actually found out that structural social capital is more prominently improving. Now, social capital is something non-monetary benefits when you gain by engaging in the communities to improve nutrition. No, this is one of the few studies which has shown that mother support groups actually have a potential to improve social capital. Now, this is another study just focusing on young age group, whether we can use mobile apps. Now, this study proved it was well taken by better accepted among young age group. And further studies, we actually want to scale this up to find out how they perceive these nutrition interventions delivered through mobile apps. Talk about the barriers. The biggest barrier we have is the infrastructure gaps. Of course, it's very difficult using a health app in communities which are rural. So there are communication barriers, infrastructure needed to communicate, data, cost for people, and limited availability of mobile phones, etc. So then limited funding for these large-scale interventions. Of course, most of the studies we have done, I think the biggest one we have done in 5 districts. All the others were done in smaller scale in Sri Lanka. And then we have a big resistance to adapt new behaviors due to many cultural norms. So opportunities, again, technology. Because I think mobile phone usage is quite high in Sri Lanka, and we have a large SMS-based, people you are using feature phones. So you can use, instead of smartphone apps, you can use SMS-based messaging, which we have tested, and it has proven quite useful. And then community empowerment, we have mother support groups, nearly over 6,600 mother support groups in Sri Lanka, so we can actually use them for nutrition improvement. And of course, policy and funding are the other things that we need. We need to incorporate these things. So recommendations, I would suggest immediate actions. We have to leverage on all these pilot programs and mHealth projects, and we can actually focus on capacity building of health workers as well as the community volunteers, such as mother support groups. So if you look at the strategic vision, we have to integrate behavior change communication into national nutrition policy. That's a must. We have to improve. If you want to improve nutrition, you have to integrate it. And we have to foster collaboration between health sector and private sector partners. We have found out it is quite beneficial if you collaborate within these two partners. So overall, at the end, we can say behavior change interventions are quite effective and feasible in addressing malnutrition. So scaling these up requires a combination of technology, community engagement, and policy support. So collaborate across sectors to achieve nutrition goals at scale. Thank you so much.
Thank you, Dr. Supun. Our next presenter is Gerald Rebello. Let me tell something about Gerald Rebello. Assume the role of Deputy Country Director and Head of the Program at United Nations World Food Program, Sri Lanka in 2023 January. In this capacity, he oversees the program units and supports the country director in managing the overall operations of the country office. Gerald brings extensive experience in supply chain operations across the multiple countries and has a strong background in humanitarian crisis. Currently, Gerald is instrumental in enabling problematic areas in Sri Lanka, aligned with 5-year country strategic plan CSP 2020-2027. He leads the nutrition and school-based programs, resilient food systems, emergency preparedness and the responses, and social protection programs. These activities aims to support the government in improving food security, addressing malnutrition, and building the resilience of vulnerable communities against recurring climate-related shocks. Let's welcome Gerald Rebello for his presentation.
Good afternoon, everyone. I think at the outset, a big shout out to IFPRI and all the collaborators for a very successful day one, a very well organized day one. This session stands between you and a nice evening in Colombo for those visiting, so just bear with us for a little while longer. So, Dr. introduced my first slide, giving us a bit of a background to the last couple of years in Sri Lanka. Many of us probably saw scenes on the television, which was basically kind of the culmination of a few things that happened across 21 and 22. Essentially, it was a poly crisis, financial, fuel, electricity, food crisis. Inflation hit 70%. I believe food inflation hit nearly 90%, or even a bit more. So this session is a little bit about a practitioner's view on how WFP responded, supported the government of Sri Lanka through this difficult period. And I think we can now say that Sri Lanka is on the road to recovery from its worst economic crisis since independence. Essentially, a couple of highlights here. In May 2022, around the time of the economic crisis, we weren't able to tell what is the food security situation in the country. The general understanding was that Sri Lanka is food secure. And this was simply because Sri Lanka generally was rice surplus, paddy production was good, and so we were food surplus. But in fact, this was against the grain. No pun intended, but this is not the definition of food security. So we had to do the first crop and food security assessment mission and and you can see at that point about nearly 30% of the population was food insecure. So that's a little bit the background to WFP's response going forward since then. So again, in true WFP style and in a practitioner's view, these are a lot of numbers here. Essentially, just wanting to focus on the numbers linked to the beneficiaries, which was about 1.5 million people supported during 2022, and going up to nearly 3 million in 2023. A big portion of this was kids going to school, grades 1 to 5, part of the National School Meals Program, nearly reaching about 1 million school kids over 8,000 schools. In addition, there was assistance to the nutrition program, Triposha. So essentially, over the next few minutes, just want to touch a little bit about four areas here. Essentially, the needs that came about during that period, and a little bit of what we did in response during the last 2 years. Like I said at the onset, we didn't exactly know what was the situation with regards to food security. WFP, along with FAO, did a rapid food security assessment, which kind of set the scene in terms of what were the actual needs in the country, which at that point were at 28% of the country was food insecure. From that point onwards, we needed to continue monitoring the situation because that was a snapshot. And that was how we continued doing remote surveys and at the same time monitoring the markets. This helped us manage the response. Now, resources were limited, not least for the government, but also from the donor community. And we had to be very targeted in our response. And so this assessment, this evidence base, helped us to manage our targeting effectively. We also were able to go down to the grassroots or go down to the field to do a lot more in terms of localized assessments. And this was a collaborative effort with multiple agencies. We also used the existing systems to do shock responsive social protection, which was the then called Samruddhi program, where we worked through the system to provide cash transfers to the most vulnerable. Essentially, we used localized systems, existing systems, to scale up our response, and we believe this was extremely effective. We also took advantage of, or we supported the school meals program, initially also giving take-home rations, but also supporting with provision of rice and red lentils to the school meals program, and supporting the Triposha program. For those of you from Sri Lanka are very aware of the Triposha program, a household name in terms of nutrition, and essentially we were able to ensure the continuity of this program despite the challenges in sourcing locally available raw material of maize and soya. So we worked to strengthen the supply chains as well. All this was being done against a backdrop of continued social behavior change, again, not only by WFP, but by partners as well, using available technology, whether it was WhatsApp messages or SMS, combined with our response programs, some of which included the voucher program and cash transfers. Again, all our programs, particularly the livelihood ones, were linked through sector coordination. We worked closely with other sectors to ensure there was coordination among the various partners. We brought in the disaster management agencies as well, who were more informed in responding to natural disasters as opposed to an economic crisis situation. So this again was an opportunity for all of us to learn from this new situation that Sri Lanka was in over the last couple of years. Again, monitoring and evaluation through the period was always continued. One big thing we did was the cost of diet analysis. We were providing cash transfers, but we also wanted to ensure the cash transfers could be used effectively. We were able to determine that the difference between an energy-only diet and a nutrition-sensitive diet is as much as 4 times more expensive. And this is a challenge we continue to grapple, which resonates with what the chairs mentioned at the start of this session. We continued to do post-distribution monitoring to ensure our targeting was effective and our assistance was reaching the most needy. Market monitoring, again, continued to determine how we continued to support and ensure that we were able to adjust our programs as we moved forward. So essentially, if I were to wrap this up in a couple of points, the decisions were evidence-based. We wanted to take advantage of the available systems to make sure that we leverage the existing platforms. We are glad that the government has moved on to a new social registry system, which helps us with improved targeting. Collaboration, again, intersectoral coordination was essential. And again, we are pleased that the government has instituted the multi-sectoral nutrition action plan, which is a call to action for all ministries, departments in the effort to address the nutrition issues. And finally, I think the constant monitoring and evaluation of programs to improve the effectiveness of programs was something we worked very closely with along with the government. So with that, let me end this presentation. Thank you.
Thank you, Gerald, for making very insightful presentation. Our next presentation is an end-to-end approach to improve fruit and vegetable production and consumption. Design, preliminary results, and the next steps from CGIAR Press Sri Lanka. We have got 2 presenters here, Quinn Marshall and Nadia Koirati. Let me speak a little bit about them. Quinn Marshall is an Associate Research Fellow in the Poverty, Health and Nutrition Division of the International Food Policy Research Institute, IFPRI, where he focuses on food systems-based approaches to improving diet quality, urban nutrition, and methods for assessing food environments. He completed his PhD in human nutrition at the Johns Hopkins Bloomberg School of Public Health in 2022 and conducted his thesis research in rural Sri Lanka using repeated market surveys to assess the food environment and their influence on the diet quality. Prior to his doctoral study, he worked in the nutrition division of the World Food Program from 2013 to 2017, supporting the development of guidance on the nutrition-sensitive program. His research interests include food affordability and food environmental related methods and the design and evaluation of cash transfer programs. He is administration in development practice from the Columbia University. Nadia Koirati is an associated research fellow in the nutrition, diets and the health units. Her research interests include food insecurity and water insecurity in low and middle income countries and during disasters. Her doctoral thesis focuses on maternal and child health in Zimbabwe, and her postdoctoral research examine food security during the COVID-19 public health emergency and other natural disaster events. Nadia receives her PhD in epidemiology from the State University of New York at Buffalo in 2022. She also holds a double master's degree in sustainable management of food quality from the Université de Montpellier, France, and the Université DG Studi della Basilicata, Italy. Thank you. Over to you.
Okay, great. Thanks, everyone. Sorry for our rather long bios. We didn't know that those would be read aloud at the very end of the day. Nadia and I are going to do this presentation together, and we've tried to kind of choreograph it as neatly as we can. But as was mentioned, we're here today to talk about a CG initiative, Fruits and Vegetables for Sustainable Healthy Diets, or FRESH, and the innovative end-to-end approach that we're evaluating. So the overall goal of FRESH, as the name would imply, is to improve fruit and vegetable intake, which is low globally, including in Sri Lanka, where just 68% of Sri Lankan adults consume the recommended quantity of fruits and vegetables. But of course, the problem is broader than the consumer alone. If we look at agricultural production, we really haven't been able to achieve the full potential of producing fruits and vegetables due to a variety of constraints, including pests and diseases, access to quality inputs, and other factors. And especially coming out of the economic crisis, consumers are really experiencing sticker shock when they're going and shopping for food, and the affordability of fruits and vegetables is a particular concern. There are many other barriers that could be listed, but those illustrate the point that these problems that are affecting the dietary intake of fruits and vegetables really exist from farm to fork. And furthermore, there's limited evidence about what works to actually improve consumption of fruits and vegetables. So as a response to this, the FRESH initiative is adopting an end-to-end approach in Sri Lanka. And what does that mean? It means starting with demand, understanding diets, and trying to put in place nudges that will improve desirability and better enable consumers to be able to eat more fruits and vegetables, but also, kind of recognizing that the impact of those types of interventions will be limited if fruits and vegetables are not also locally available, accessible, and affordable to consumers and of high quality. So we're also working with farmers at the production stage, along the supply chains, and with the vendors in the food environment. And importantly, the idea is to try to co-locate and coordinate these different interventions as best as we can. So we're working in 2 areas of the Badula and Ratnapura districts where we have set up production hubs where we're testing and disseminating good agricultural practices among farmers and also trying to improve their access to key inputs such as seeds. In addition to that, the idea is to kind of layer on these demand and food environment targeted interventions, which currently exist in the form of a menu of options that we've put together based on fairly extensive stakeholder engagement and also desk reviews. And hopefully at the end of the presentation, we'll have a chance for Nadia to explain a bit more about how we plan to further select and develop those. But of course, moving from the intervention to the evaluation that we're talking about now, the main thing we want to know, the main research question is does this actually work? What are the impacts of these fresh supply, food environment, and demand activities on production of vegetables and dietary intake of fruits and vegetables? But we're also kind of looking at the context in which these interventions are being implemented. So we have both urban and rural settings within our study, and we're also carrying out a food environment assessment to get a better sense for the accessibility issues around fruits and vegetables. And I'll hand it over to Nadia now to go through some more details about the design and some preliminary findings.
So following Quinn, my slide is slightly more technical. This is our study design. To answer the question that Quinn just mentioned, we designed a cluster-matched and partially randomized controlled trial. And here by cluster, I mean villages for the rural areas and towns for the urban areas. So we have 3 groups of interest. One is the rural production area, the other is the rural non-production area, and a third, the urban areas. So the fresh supply side pilot activities that Quinn mentioned right before this slide have already started in Ratnapura and Badula districts in only certain villages. And those pilot studies will be scaled up. So to increase comparability of eventual impact evaluations, we matched villages from the non-production rural areas onto the pre-selected villages that are currently receiving supply activities. For the urban areas, the randomization was more straightforward in that 50 towns were randomly selected from a list of all the towns in the 2 districts. So we have, these groups and study arms have already been assigned, and households within the villages have also been randomly assigned to these separate clusters. And we recently completed a baseline survey in October 2024. We conducted multiple surveys, including households, diet, and food environment assessments. And we are already also planning a pre-intervention baseline survey for next year. Following that baseline survey, an intervention will be implemented for either 1 or 2 years, 2-year period. And at the end line, again, we'll carry another survey, and we will use a difference in difference analysis to assess the impact of various packages of interventions on dietary intake of fruits and vegetables. So, for example, comparison of T1 and T3, T1 being the rural production areas that will eventually receive, in addition to the supply activities, the food environment and the demand interventions. So that will give us the impact of the whole fresh end-to-end supply, demand, and food environment package of interventions. And we'll also be able to explore the impact of supply side only when comparing baseline to end line changes in groups, T1 versus T2, T2 being the group that will receive only the demand and food environment interventions. The same thing for the urban areas, so comparison between the study arm that will receive the demand and food environment interventions versus the control. Okay, that was a lot. You can ask me questions about that later. So our baseline surveys included a household survey that consisted of a roster for the family members, assets of the household, shocks that they've experienced, crop cultivation, food consumption and expenditure, drivers of food choices, and food and water insecurity measures. We also had dietary intake assessment using a 24-hour dietary recall via phone calls with both men and women, as well as fruits and vegetable consumption frequency questionnaires. And Quinn already talked about the food environment assessments that included census of market retail outlets as well as vendors, and information on marketing and ads and quality, availability, and prices were also collected. So the impact assessment will eventually be conducted, but for today, I just wanted to share an overview of the baseline characteristics of the population that we are studying. And that's a critical step because understanding our target population gives us an idea of the actual needs of that population and will help support and inform whatever interventions we think may be impactful. So let's get right into it. We had 2,872 households that were interviewed, and of these, 87% were male-headed households. On average, they had 4 members. 24% of the households included children under 5. We had participants from Badula, 54%, and 61% were rural households, and the majority of our households were Sinhala. So household food expenditure, the monthly per capita food expenditure per our baseline surveys was 4,160 Sri Lankan rupees, and that was 60% of the total household expenditure. You'll notice here that 25% of that food budget was associated with grains, white roots, tubers, and plantains. Leafy vegetables accounted only for 1% of the food budget, but in total, leafy vegetables, non-leafy vegetables, and fruits accounted for 19% of the food budget. And compared to rural residents, urban residents spent more on proteins, milk, and eggs. And compared to rural residents, urban residents spent less on leafy vegetables, fruits, oils, fats, nuts, and seeds, and grains, white roots, tubers, and plantains. I see that my time's up, apparently. So I'll go, what's that? Okay, thanks. So the diversity of fruits and vegetables cultivated at the household level included 31% of all households who cultivated fruits and 36.9% of households that cultivated vegetables. The most commonly cultivated fruits included ripe bananas, mango, avocado, guava, oranges. And for vegetables, that was green beans, almost twice as much as tomatoes, green chilies, brinjal, and carrots. Dietary intake among the women and men aged 20 to 49 years of age, which was our age group of interest, was fairly similar across both men and women, except for other fruits, pulses, and dairy, where women consumed way more than men. Over to Quinn.
Get my walk-up music again. So we're going to cut out just the last part of our presentation, but I just wanted to kind of quickly share a few of, some of the findings we're getting from the food environment assessment. So we kind of started with a census of all the different vendors in the area. This is showing the two different study areas as well as the urban, which is in the green, and the rural, which is in the orange. All those little green dots are the outlets that were selling fruits and vegetables. The red ones are where you couldn't find them, and we'll do kind of a more formal geospatial analysis of this, but kind of just visually, you're getting the sense that, there doesn't seem to be too many pockets where there's just no fruits and vegetables available. We looked at kind of this vendor typology and saw that most of the outlets are kind of small retail shops, which is sort of just a generic retail format in Sri Lanka. There's typically places where you can buy dry foods and may or may not be able to buy fruits and vegetables. In the urban areas, you kind of see some more specialized types of vendors like fruit and vegetable stalls, butchers, fish shops, or other specialty shops where you don't see those quite as much in the rural areas. And we saw that about a quarter of the shops had fruits or vegetables, which is a lot lower than processed and packaged food items, which was the most commonly found food group. And interestingly, in almost all the different types of food, rural outlets had more of them, which could come as a surprise, but one working theory might kind of be that due to the population density in the urban areas, vendors can specialize a little bit more, whereas in rural areas, these shops kind of need to be a one-stop shop for the people going to buy food there. So we've continued from that census doing a monthly in-depth assessment and a subsample, and we don't have more time to go through all the findings, but I just wanted to kind of touch on the cost of diet because it relates to the food expenditure that Nadia shared. We saw that in rural areas it was about 311 rupees per person per day, actually a little bit lower in urban areas, and this is based on the 2021 Sri Lanka Food-Based Dietary Guidelines. So fruits and vegetables, which are those orange, green, and yellow triangles, were about a third of what the cost of the diet is. If you kind of compare that to what the FAO publishes in their SOFI report for the healthy diet basket, it's actually lower. Theirs winds up being around 40%. It's of course a different food basket, but still kind of similar in terms of what the requirements are for fruits and vegetables. However, if you compare this to the household expenditure data that Nadia shared, we actually see that households in the study area are allocating a far lower amount of what they're actually spending to fruits and vegetables. So we had a slide on what our next steps are to kind of further elaborate our demands and food environment interventions, but maybe somebody will ask us what our next steps are in the Q&A. Thank you.
Okay. Thank you very much.
Oh,
Let me first invite all the 4 presenters to the stage, please. First of all, I would like to join Professor Chandrasekhara in congratulating all 4 presenters for their excellent presentations, as well as finishing all the presentations more or less within the given time frame so that we have enough time to have a discussion. Now, with that, I'm going to open the floor for discussions. Before we take any questions, please avoid giving long statements and your views. That I think we should reserve for tomorrow's tea, or I don't know whether you have a dinner tonight. But I will kindly request you to ask the question in a very precise and short manner. And as well as please identify yourself and also tell us to whom is the question directed in the, among the presenters. So the floor is open for questions.
Good evening. So my name is Arpit Singh and I work as a senior associate at ICRW, International Center for Women's. So my question is to the first panel member, the first presenter. So you have looked into the behavior interventions part. So my question is that, have you looked into the behavior interventions regarding to the peers of the woman? Because it has been found out in the several studies that the peers have play a very influential role in decision-making process. If yes, so what were the results that you have found in those interventions? And do you think that these we should develop such interventions, behavior interventions, which includes the peers of the women also or not? Thank you.
Let us take two more questions.
Thank you very much for the excellent presentations, which were very insightful. As a student of public health and anthropology, my curiosity is for the first presenter, I'm the consultant for the behavioral change interventions, improve nutrition at scale. In the context of the behavior change interventions, we also, aid the social and behavior change interventions. Although you mentioned about the community engagement and all these things in terms of empowering people in decision making to access safe and nutritious, food or food security, whatever we call. Because behavior change interventions encompass lots of other contexts, for example, social context, cultural context, economic context, political context, psychological context, and all these, the larger cultural context kind of things. I found your presentation quite interesting, but I would also like to know or learn from you. Is there any? Have you also considered the other aspects or the environmental aspects of it? For example, how gender norms or social norms or values also affect the behavior change kind of things. The earlier question was around, the peer-led or peer kind of communication kind of things. Are there any other initiatives or new innovations in behavior change intervention that is practiced in Sri Lanka, or are the aspects that I try to emphasize? Have you also looked into that at that scale? This is just my curiosity. Thank you.
I think both these questions were directed to Dr. Supun. Remember your surnames, Vijay. Would you like to answer these two questions?
Yes, thank you so much. I think two very interesting questions. Both of them are quite important. To answer the first one, so what we actually did was a pre-post quasi-experimental study. So it was coupled with cash transfer program. So the whole program consists of cash transfers plus the social behavior change component. So the social behavior change component consisted of regular sending WhatsApp messages to these communities. And the first study which I described consists of trainings to the groups who are receiving these WhatsApp messages, and then the people who are not receiving the WhatsApp messages, they have opted for SMS-based messages. And their husbands, like, we consider two types of peers. So immediate peers were the family members who were supporting this. I think first question, yes, we did a mix. There was a qualitative component also. That was a sort of a mixed method study. So we asked, after receiving these messages, because we sent the messages to the householder as well as the rest of the community, people in the family. How the husbands, I think you saw from the quotes, qualitative quotes, the husbands' attitudes change. So, some of the households were female-headed households. So gender norms were there in our committees as well. So male-headed households are also there. We didn't exactly take account how many households as such. So of course, peer influence, we actually got it from a qualitative component of the study. As for the second question, that is also important. So the model we focused on was something called socio-ecological model. However, it consists of three things. One is the behavior change, immediately focusing on the change of the behavior for the mother or person with the under 5 child, and then surrounding aspects, the peers, and then the wider social determinants or the environmental factors. Unfortunately, we were unable to target the environmental factors. We only focused on the first two levels of the socio-ecological model. So I think we didn't have any data about the, the surrounding, advocacy measures, environmental measures, other social determinants. We had limited data related to that. That's why I think probably much more robust design like a cluster randomized trial, which we discussed yesterday in one of the meetings, probably we could have a better insight into taking account into these wider, social determinants for that. So thank you so much.
Thank you. And now again, we can take a couple of more questions.
Hello, this is Aklima Parvin from Bangladesh Country Office, IFPRI Bangladesh Country Office. So my question also is to first speaker, Dr. Super. So we have experience with our implementation of mother support group for breastfeeding support program. And we found that actually sustainability was an issue because the members are mostly voluntarily engaged. Just one question, whether the mother support group you have mentioned for community engagement, are they incentivized or voluntary or employed?
Thank you. My question is to Nadia. It's about partially randomized design. So I didn't understand what it is and why did you do that?
Can we have one more question, please?
My question is also to Nadia. You have calculated percentages of expenditure across food commodities, but they are different in that means the prices are different in those commodities. So how can you justify allocating these percentages of these commodities?
Okay, thank you. I think I will hand over to Nadia and Quinn to answer the last two questions.
Thank you for the question. I love talking about study design. So the reason why we did a cluster-matched randomized controlled trial is because we have a work package that is focused on supply and production activities. And these activities have already started. So we have pre-selected villages that are already experiencing interventions. So to be able to do an impact evaluation at the end of the study, we need to have comparable control group or a counterfactual group that you can actually compare with. So the matching process allows that comparability so that we can have an actual causal association towards the end of the intervention. And the randomization part is the fact that we chose out of a list of rural non-production villages, we had, I think, over 80 rural villages. So out of those, we randomly selected 50 to represent those matched villages. I hope that's a little clearer.
Thanks. Well, just to add to that too, like we had a lot of back and forth with our colleagues that are working on the agricultural production activities, and asking them, how can you roll out this program? Would you be able to randomize it? Randomly do the production hubs in certain villages, and that just like wasn't the way that their logistics work. So that's why we kind of have this partially randomized design and used matching instead. I think I understood the question about the cost of diet and how we can allocate the percentages across the different food groups. Maybe it's because I didn't get a good chance to give a background about like what this food basket looks like that we're costing out, but it's based on the Sri Lanka 2021 food-based dietary guidelines, which kind of indicate like what's the quantities that you should have across these different food groups, as well as other information like, you should have a variety of fruits, not just one fruit. You should have a green leafy vegetable in addition to other vegetables. So you kind of cost that out, and then, the percentages are taking the lowest cost items, in each of those categories in the villages that we gathered the data from.
And you hand over to Supun Vijay Singh for the last question.
Yeah, thank you so much for that question. So your question was, what type of a community health worker is a mother support group? Now, in Sri Lanka, I mean, we have a lot of community categories of community health workers. Some of them are paid in other countries, but in Sri Lanka, the mother support group members are purely voluntary basis. So the groups are about like 5 to 20 people, which are facilitated by a public health midwife, who is one of the health care workers in Sri Lanka. So that is a salaried position, healthcare worker, as well as the public health midwife, as well as the public health inspector. But these are group of community workers who are not being paid, but we usually train them so they get their non-monetary benefits through social capital. They can show their children to the MOHs, the medical officer of health, get access to these things. So those are the benefits they get, but they are not paid harder positions in Sri Lankan health structure. So they are purely voluntary. We have about 6,649 at the moment. So it's becoming quite useful for us to mobilize these groups to improve the nutrition of under 5 children and pregnant mothers. Of course, we do cash transfer programs to support them, but they are not being paid for anything what they are doing in the community. So they are purely voluntary health structure or community health workers working for voluntary purposes. Thank you.
Thank you, Dr. Vijay Singh. Any more questions? Okay, I think we still have a little bit more time. Let me ask one question from Quinn and Nadia regarding your randomized, the experiment that you have designed before around 2021, and the numbers you have shown also, the amount spent on food is like 14,000 something. That was 2021 number, I guess. But now after that, actually the whole social economic system went through a huge change with the economic crisis. Food price inflation was like 98%. Now the inflation rate has come down, but food prices are very high. So my question is actually, now probably you can adjust inflation to your numbers, but when you design experiment and do the benchmark survey, and then the society go through a huge unprecedented change in economic, social, and all the other aspects, how can you capture those changes in your in you really quantifying the impact of your experiment? Is it possible to capture that?
Yes, to a certain extent. So first, the value, 14,000 plus Sri Lankan rupees, that's the baseline survey that we conducted this year. So that's a value from this year, yeah, so 2024. Looking at the characteristics of the households, so the baseline was conducted this year. And like you said, things change over time, which is why we are planning a second pre-intervention survey before we do the intervention. So the intervention or intervention packages haven't been designed yet. We are working on that, and we are co-designing the intervention with a group of stakeholders, beneficiaries, in collaboration with GAIN. So that's going to take place next week. We're excited about that. So people who are in the community will be the ones to tell us what is most likely to work for the population that we've targeted. So the fact that we are doing multiple surveys will in part incorporate those changes in the analysis that we do. And also we are collecting data on the demographics, on the programs that are already involved in the community. So all those things can be used as covariates or confounders in the data analysis that we do.
Thank you, Nadia. Thank you for excellent explanation. I think time is up. We have only a few minutes. With that, I will invite Professor Chandrasekhar to give his closing remarks.
Thank you very much. Thank you all. And we had a very wonderful so much of insightful presentations, and a lot of presentation made us to think more, and a lot of questions we have. But since we don't have enough time to discuss all the things, so therefore I think we must thank all the presenters for making effort to make these interesting presentations, and all the participants and asking questions about the topics that they are interested about or they are having certain questions about. Thank you, and I think that's all about from this.
Thank you. You want to say something?
Yes, yes.
Okay.
I also have 1 or 2 minutes, please.
Oh, okay.
So again, thank you, everybody. I have few observations that I want to, highlight. First of all, I would like to thank the World Food Programme for the assistance provided during this very difficult time. And but I want to highlight one thing, that you all have tried your best to align with the Samurdhi program, which was the existing social protection program. But that program had about 48% of exclusion errors. And then we replaced that with the Aswasuma program, which nobody has yet estimated the exclusion inclusion errors. Our own preliminary estimates say about 71%. So I'm just alerting you all. You are doing great job in Sri Lanka, but I think the assistance provided by you all are very valuable, but we need to really look at the exclusion error part very carefully to make them very effective. In that sense, I think the presentation by Dr. Supun Vijayasinghe will also bring us something very important. These communication-based awareness building and behavioral change aspects are universal. Targeting issues are, that approach is not sufficient to solve all the problems, but the targeting issues are avoided in that one. I think we can certainly, focus more on those things to get more benefits. Finally, I think I have a couple of other points, but I don't want to waste your time. I'm sure you are tired. To Nadia and Quinn, I think when I saw that model that you're talking about enhancing the demand and then through that augmenting supply to improve the consumption of fruits and vegetables. But this is a theoretically correct approach. But given the current situation in the country, now the demand enhancement should be supported by actually affordability. Now the country is actually in a still very dire situation. Economy is now a bit stable, but still the stability benefit has not gone down to the grassroots levels. Still a lot of people are poor. Their ability to purchase food is very low. I kindly request you to take that factor into account and think again how we can really address this affordability issue in your research. With that, these are my comments, and thank you for the excellent presentations, and please join with me for giving a big applaud for the all presentation. And also for the excellent logistic arrangement by Asha Saraswat and her Isha Saraswat and her team. Again, join me.
Thank you. Thank you so much, Dr. Gunatilake and Professor Chandrasekhara. Thank you so much for moderating the session, keeping us on time, and for the discussions. While the chairs and the panel is having a group photo, I would like all of you to just stay with us for another 2 minutes. Can we have the group photo for the audience? In the meantime, I would like to just announce few details for tomorrow's session. You can all stand up for the photo. Tomorrow we are starting at 9 a.m. The registration will be 8 to 9 and the sessions will start at 9 a.m. We'll start with a plenary session, which is a research showcase on connecting dots across systems for better nutrition. Then we will have 2 thematic sessions, one in the morning and one post-lunch. We will again break into 3 learning labs. Tomorrow we have 3 learning labs, one by Wayamba University of Sri Lanka, one by World Bank, and the third by Nutrition International. And then towards the end of the day today, we have a very exciting session where we have a chef talking to us about breaking norms for better nutrition. So I request all of you to kindly join us at 8 a.m. tomorrow. Tomorrow we will also have the conference dinner, which will start 6:30 p.m. onwards. So those who can stay with us for the dinner, you are most invited. The last bit for the day is that, as I introduced in my opening plenary, that we have a small Q&A for you to answer, basically a feedback to give to us at the end of each day. So if you can take out your phone, scan the QR code for day 1, and just click yes and no for the questions that are asked. Towards the end of the conference, we'll have a lucky draw, and one of you who has taken the quiz will win a cute small prize. So please scan the QR code and take this quiz. Our online participants can access the QR code, and also the link is shared with you over the chat. So take 1 minute, do this, and then we are all free for the evening to enjoy the beautiful Colombo, and hope to see all of you tomorrow at 8 a.m. for the registration and 9 a.m. for the sessions to start. Thank you so much, and see you tomorrow.